Hello, my name is Eric Sasemsky from Beth Israel Deaconess Medical Center in Boston, Massachusetts. I appreciate the opportunity to present this talk to you titled Must Read Articles in CLI as part of Cardiovascular Innovations Digital 2020 Conference. And I want to just display my disclosures and we'll get started. So again, the title of this talk is Must Read Articles in CLI, but I'm going to deviate from this just a touch and spend some time both reviewing some recent articles as well as some upcoming technology and recently presented results, as I'd like everybody to kind of see what's on the horizon for the coming year. So I just want to start with a recent publication by Konstantinos Katsanos on a meta-analysis examining mortality and amputation in patients with infrapopliteal artery disease and critical limb ischemia. Now, as everybody's familiar with, these are the same author group that performed the first meta-analysis of randomized trials of the femoral popliteal artery segment, demonstrating concerns about long-term survival with drug-coated device treatment. For this paper, they looked at they looked at 7 different studies of below-the-knee use of drug-coated devices, primarily for critical limb ischemia. And these studies were of variable quality. Some were presented but not published yet, and some of these were published. And they had to have follow-up between 6 to 12 months. And importantly, one of the largest trials here, which was the Lutonix BTK trial, only had their 6-month data available. So this was a little bit of an incomplete meta-analysis, again, with a variety of devices, some of which are not commercially available and may not be commercially available. So I think we have to be guarded with the interpretation here, but I do think it's important to review because this was an important article published recently. And in this analysis, the authors found that amputation-free survival among these 7 trials was worse among patients who got the below-the-knee drug-coated device. So a hazard ratio here of 1.52, suggesting some evidence of harm with drug-coated device treatment below the knee, again, on a short time frame in the 6 to 12-month period. And when he broke down this endpoint by all-cause death and measured amputations, these risk estimates were similar, the relative risk, but the significance was violated. It was not significance due to the fact that these were smaller groups of patients or a smaller endpoint, but just highlighting the fact that they did find evidence of harm here. And interestingly, they also found evidence of benefit with a reduction in target lesion revascularization and a relative risk of 0.53. Now, again, I want this study to be interpreted with the caveats of these were some non-published data. The largest study, which also have shown the most safety, is the Lutonix BTK trial, and they only had the 6-month results. And so we must really think cautiously about the impact of this study. I will make a comment that we have published or presented data on the critical limb ischemia patient population in the femoral artery segment revascularization. These are data that I presented at the FDA panel in 2019. And the total population was over 150,000 Medicare patients. In this portion of the analysis, 58,000 had critical limb ischemia. And we can see here through more than 4 years of follow-up, patients who were treated with drug-coated devices in red had slightly lower mortality than patients treated with non-drug-coated devices, which is in blue, with a hazard ratio of 0.94 and a p-value of less than 0.01. So we found no evidence of harm with drug-coated device therapy in the femoral popliteal artery segment for patients with critical limb ischemia. Now, this is the 6-month data from Jahad Mustafa and colleagues looking at the Lutonix BTK trial results. This was published in JIC in 2019. And these are the efficacy results. On the left panel here is clinically driven TLR. On the right here is loss of primary patency. And blue is drug-coated balloon, and red is standard PTA. And in this really critical study of patients treated with the below-the-knee device, there was efficacy through 6 months for drug-coated balloon treatment compared to standard PTA. And we saw a nice reduction of nearly 8% in clinically driven TLR and in nearly 15% for primary patency. Now, the 12-month results were just presented at the LINC conference in 2020, again by Jahad Mustafa. And again, this is the demographics of this patient population that totaled just under 500 patients. These patients were, average age of 73, primarily male, a lot of comorbidities, long lesion lengths, and high rates of occlusion. So really representative of what we would expect in a real-world population. And as we can see here, for the efficacy endpoint at 1 year, which was a composite of above the ankle amputation, target lesion occlusion, and clinically driven TLR, there was a benefit again observed at 6 months, but this attenuated at 12 months. So it was no longer significant at 12 months, but really we maintained that at 6 months, the authors found that 14% reduction in clinically driven TLR in their efficacy endpoint. And really, when we think about wound healing for CLI, that's probably really what we want, is to get 6 months, 6+ months of patency out so that we can really improve healing rates. And you look at clinically driven TLR out through 12 months, you get this similar attenuation after 6 months. But again, we really see a nice benefit in those first 6 months. When you look at all-cause death out through more than 1,000 days, it was exactly overlapping, similar between DCB and PTA. So again, this feeds back to that Katsanos meta-analysis. These data weren't in it because they only went up to 6 months. They saw no difference in all-cause death, and similarly no difference in amputation-free survival, 78% in each group. So switching gears, I want to just talk a little bit about some advances in technology that are on their way. This is the Micromedical Solutions MicroStent. It's a dedicated BTK stent that comes in 4 different diameters, lengths up to 60 millimeters, and really impressively 2 shaft size, both 40 and 120 centimeter shafts, so that they can be used through a pedal approach. They go through a 3 French system. And these are some early results presented by Robert Beasley at LINC 2020. In this patient population, again, severe stenosis, long lesions. These are a real-world representative population in the feasibility study. They had 100% delivery success, 82% improvement in Rutherford classification, and 91% primary patency at 12 months. And this is really a great start for this device. It's going to be undergoing its pivotal trial. I think the first patient was enrolled in May, and we'll see 177 targeted patients for this trial with 6-month patency follow-up, or primary follow-up for the primary design. I want to move next to the ABSORB BTK study. This is an incredibly important study run by Ramon Barco and colleagues. These data were presented, updated data at LINC 2020, and I'll show you 2 prior publications of these data that have been in the literature. So this was a study that looked at the use of the first generation of the absorbable Abbott's ABSORB stent. So this is the first generation stent. And the goal here was really to see how it served as a platform in the below the knee arteries. These were primary critical limb ischemia patients. And again, most diameters were between 2.5 and 4 with target lesions less than 5 centimeters. In total, they enrolled 48 patients with 55 limbs. These are the published 1-year results in JACC Interventions a couple years ago, which showed really nice primary patency with the ABSORB stent, 89.2%, with freedom from clinically driven TLR of 97.2%. When you move on to the 3-year results, you still see very strong primary patency at 80.3% with CDTLR of 90.7%. And again, more contemporarily, these are the 5-year results that were presented for the first time, and maintained primary patency at these lesions for 72.9% with freedom from clinically driven TLR of 90.7% rate. Now, again, patients died. There was some attenuation in the sample size, but pretty impressive rates for those who survived with patency rates that matched that. So impressive from the first generation of the ABSORB stent, and Life BTK, which will be kicking off soon with my colleagues, Ramon Barco and Sahil Parikh, as well, and Brian D. Rubertis. We'll be looking at the next generation of the ABSORB stent, the Spirit BTK bioresorbable scaffold, and I'm really excited about this trial kicking off in the near future. Now, on the same kind of category of below the knee intervention and scaffolding, the TACT endovascular system has really made an important mark on the field. These devices come through a 4 French system. They have 4 preloaded devices, and they're made for dissection treatment. So really for residual clinically important dissections, this is a way to tack down these vessels and but avoid putting in a large scaffold. The TOBA II BTK pivotal study looked at the use of this in 233 patients. This was the pivotal trial for the FDA approval. And these are the primary endpoints at 30 days, which were met based on a performance goal and kind of blew it out of the water, 1.3% for male and POD at 12 versus a 12% performance goal. And at 6 months, again, the performance goal is 74%, and then the intention to treat at a 95.6% rate. So really impressive stuff for efficacy and safety. And then if you look at the KM curves here at 6 months, you can see that segmented detect patency of 87.7% and target lesion patency of 87.3%. Limb salvage rates of close to 100% at 6 months, and freedom from TLR at 92%, and also improvement in wound status in a large portion of this population. So really impressive data at 6 months. Most recently, just a couple weeks ago on the VIVA late breaking clinical trial, my colleague Pat Garrighy presented the 12-month data, which showed no fracture, migration, or embolization of the stent, and an 81% patency rate and 83% clinically driven TLR rates, and really impressive for this patient population. This was preceded by FDA approval of this device, so really a great program for TOBA II BTK, and a great device for us to be considering a below-the-knee intervention for CLI. Lastly, I just want to touch on this quick study called the Prestige Pilot Study. And this is an atherectomy DCB study of 75 patients, but it has an adjunct IVUS arm. And I think we're going to be hearing a lot about IVUS in the near future, as this is going to be really the next wave of how we do peripheral interventions. In this study of 35 patients, really with patients who have advanced below-the-knee disease and critical limb ischemia, it was really impressive what IVUS did for this patient population. When you look at what the reference vessel was as deemed on angiography versus on IVUS, you can see that the diameter of the vessel is nearly 1 millimeter different, which is really clinically relevant, as we all know. And IVUS helped understand sizing of these vessels so critically in this patient population, to the point that diameter stenoses decreased substantially, guided both by atherectomy, DCB, and IVUS use. So we saw really a nice reduction in TLR rates or lesion stenoses, of more than 70% with this guided therapy. So really something to keep on the radar for the coming future. I'll end here. Thank you very much for your attention, and I look forward to the next conference where we get to see each other in person. Thank you.